Hi, and my name is Kirsty, and I am one of the heart failure nurses here at the Bristol Heart Institute. My job is to look after heart failure patients who are here at the Heart Institute, but also in all the medical wards around the BRI. And I'm going to speak to you a little bit today about chronic heart failure and its management. So we'll look at what is heart failure, what are some of the causes, what are some of the treatment options, and what is it actually like to live with heart failure, and what are some of the tips we have to help you live with heart failure. Now that word, heart failure, that often sends people into a bit of a spin, that they feel like the heart is failing and it means all sorts of awful things. But actually all it is a collection of signs and symptoms which can occur when your heart muscle is damaged or weakened. So the heart struggles to pump enough blood and oxygen around the body to meet its needs. So what actually happens? Okay, so that heart muscle is weakened. So not all the blood and fluid is pumped to the kidneys. And so the hormonal system in the kidneys is going, oh, what's going on? And so that then means that the body holds on to all the excess fluid because it thinks it needs to. But then the body has nowhere to put all that excess fluid. And so it thinks, right, I'll put it into the lungs and the legs and the abdomen, where we actually don't want it. And that's when some of these symptoms can come about. And when people can feel really breathless, especially when lying down at night, or they start coughing and wheezing. People can get really tired and fatigued when they normally wouldn't. They can feel a rapid heartbeat or palpitations. And some people, they get really short of breath when they just walk into the shops or up the stairs. You'll often notice that with some people, they get swelling in their ankles or their feet or legs or abdomen, and we don't like it being there, and feel really tight. It might be that you weigh yourself regularly and you notice that suddenly you put weight on in a really short space of time, which you wouldn't normally see if you put on weight because you've been eating a lot. For some people, it often means that they have to go to the toilet a lot more to urinate, especially at night, and it can make it really annoying when you're trying to get on with your everyday life. So what are some of the causes of heart failure? Well, there's some people come in with a heart attack, with ischemic heart disease, and that can cause the heart muscle to be lacking in oxygen, and meaning that the heart muscle becomes damaged and weakened. Some people are diagnosed with cardiomyopathies, so there's problems with the structure of their heart. If you've had high blood pressure for a long period of time, that can also cause damage to the heart muscle wall as well. If you have other problems with the structure of your heart, such as your valves, or you're having lots of arrhythmias and fast heartbeats, that can, over a long period of time, cause problems with your heart muscle as well. Unfortunately, some people, they get a viral infection and it goes to the heart muscle wall and can cause that become weakened as well. For some people, they're having treatment for cancer and it's supposed to be helping with their cancer, but the side effect means it can also be toxic to the heart muscle. Other things such as anemia, alcohol, pregnancy can put strains on the heart and cause it to not work as well as it should do. For some, these things can be reversed and the heart failure can improve and your heart muscle can get a lot better. But for some people, it can stay that way and always be a bit weak and a bit damaged. So how do we diagnose heart failure in the first place? Say if you had no idea you had anything wrong with your heart and you went to your GP with some of the signs and symptoms we talked about. Well, the GP would do a blood test, and that blood test checks levels of a hormone in your body which is raised when you're in heart failure. They might then send you to the hospital to have a scan of your heart. That's an ultrasound scan, a bit like if you were pregnant and they want to look at the baby. But they do that on the heart muscle. And they'd have a look at the heart wall in that way and see if it's pumping as strong as it should do. The GP would then also get you to do lots of things to see if he can find other clues, if this might be heart failure. So he'll ask you some of the questions we went through about your symptoms. Are you able to lie flat at night? Or have you noticed you've had to put your pillows up a few more times than you normally would do? Are you getting breathless when going up the stairs and you normally wouldn't do? Have you suddenly put on weight? They'll also do an ECG, which is where they put the stickers on your chest and have a look at the tracings of your heart. And that sometimes can give them a clue that there's something going on with the heart muscle. They'll take your blood pressure, and the blood pressure being up and down can give them an idea about how that's being managed and if they have to do anything with that. And they'll also have a bit of a poke and a prod, and they'll have a look at your feet and your abdomen and listen to your lungs with the stethoscope. There are different ways we can figure out how bad are your symptoms. And we use something called an NYHA class, which basically says, I'm able to do everything I can normally do, thank you very much. Or, oh, I can do some things, but actually when I really push myself, that's when I get a bit breathless. And then there's another stage where actually I'm finding it quite hard to move around because I'm getting breathless with my symptoms. And then for some people, their heart failure symptoms can be so bad they're sitting on their chair and they're finding it difficult to breathe. And so this classification can help the doctors find out each time that they see you how bad your symptoms are and if they're getting better or worse. So how do we treat it? Our whole aim with heart failure is to try and improve your symptoms, to reduce them as much as possible. And we attack it from lots of different fronts. The first front is with medications, and we'll go through them in a minute or so. The next step we can look at is lifestyle. That's something that you can do to help improve your symptoms. We also look at psychosocial. How are you feeling about this? Who have you got around you as a support network? And then the last thing that we may consider is interventions and devices that can help strengthen your heart muscle. So with heart failure medications, what are the aim? The aim with heart failure medications is to try and get you to live as long as possible, for you to be admitted to hospitals as infrequently as possible. We don't want to see you admitted if at all possible. And also just to make you feel better. That is our aim, that is our goal. So how do we do that with the medications? Well, we give you medications that look at reducing the heart rate, stopping those hormonal systems from saying, no, hold on to fluid and water. And then we actually get rid of any excess fluid and salt that you might have in your body as well. So some of the medications we're going to talk about work in that way to help us look at different ways that we can make you feel a bit better. So the first thing that I'm sure a lot of people will be familiar with is water tablets, diuretics. Now they're the ones that make you, well, for a lot of people, go to the toilet a lot more than they would like to, especially when they're in the shops, seeing some friends in the car, trying to take a long journey, and they're like, oh, I need the toilet again. And these diuretic tablets, you'll see them known as furosemide or bumetanide. They can obviously remove some of this excess water from your legs, from your abdomen, to make the swelling go down, to help you breathe a bit better in your lungs. But yes, they have that side effect of making you need to go to the toilet a lot more. They can also have some side effects to watch out for in terms of muscle cramps. And for some people, it does make them feel a bit more nausea and with some headaches as well. So if you're getting some of those, it's just to let your heart failure nurse know, or GP. Your GP will need to do lots of regular blood tests because we want to make sure that we're not causing any damage to your kidneys as a result of making you go to the toilet a lot more. So that is removing excess salt and fluid. Tick, we've done that one. So next we're going to look at tablets that act on the hormonal systems, which are telling your body to hold on to all the salt and the water. These tablets stop your blood pressure from increasing and your body from holding on to water and salt. So the 3 tablets that you might be on are either ACE inhibitors, which include ramipril, lisinopril, or enalapril. They may be ARBs, which are candesartan or losartan. And they might be this new tablet that we've been using for a few years now called Entresto, or sacubitril valsartan. That's a bit of a big word. Now, we've said here that it's an amber drug. That basically means that we in the hospital need to prescribe it to you first before your GP then takes over after a couple of months. So your GP won't start that, but we will here in the hospital, or your specialist consultants. For some people, they may already have been on Ramipril or lisinopril or enalapril before we put you onto Entresto, but you should never be on both of them at the same time. And you should normally have a little break after you've stopped taking Ramipril before you start taking Entresto. And that's just to give your body some time to adjust. So great, we've now looked at 2 of the ways that we help your body with heart failure with medications. We've looked at removing excess salt and fluid, and we've looked at acting on some of the hormonal systems. So what about reducing the heart rate? These medications are called beta blockers. Basically, they block the hormone adrenaline, and that lowers the heart rate and sometimes the blood pressure as well. The side effects with bisoprolol, depending on how much you are on, can be a bit more tired, especially at first, cold hands and feet, and a slow heart rate. So that's why we would start you on a lower dose and gradually increase it to see how you're doing with it and how you're managing that. And it might be that we have to decrease it if you're not managing the side effects very well. One of the other groups of tablets that you might also be on is something called spironolactone or eplerenone, and these also block a hormone called aldosterone. Aldosterone makes the body hold on to water and salt, and so if we block that, it basically helps get rid of some of the excess fluid. That tablet can be really helpful in reducing breathlessness and fluid retention. So yes, another tablet that might make you use the toilet a bit more. The side effects of that, it can actually increase something called potassium in your blood and put a strain on the kidneys. So your GP will need to do some blood tests to keep an eye once again that we're not doing any damage to your kidneys. For some people with spironolactone, it can make you have diarrhea, so it's watching out for that side effect and to let your heart failure nurse or GP know if you're having that. And for men, they might notice that they're having actually, their chest wall is becoming a bit enlarged and they're getting what we would call enlarged breasts. And they're not breasts, but it's that tissue is just becoming a bit enlarged. And so if you're noticing that and it's a problem for you, then it's letting your heart failure nurse or GP know. The last tablet that we've been using only for the past couple of years is called dapagliflozin. This basically makes the kidneys excrete more sugar and fluid, and you might be more familiar with it in diabetes, but we have found that this works really well in protecting the heart as well. This can help people feel less breathless and less fatigued. So in our book, it's a good one. But because you're getting rid of more sugar, you might be getting more frequent urinary infections or genital thrush. And if that's the case, we don't want that to be something that's causing you more of a trouble. And so once again, get in touch with your heart failure nurse or GP. So when it comes to your tablets, obviously we want you to take them, but we have something called sick day rules. This is what to do with your medications if you become unwell. Obviously, if you are getting a lot of diarrhea and vomiting and you're not keeping anything down, it's maybe not a good idea to take some of these medications that affect your blood pressure. So if at any point that you are feeling unwell with any diarrhea or vomiting, we don't want to put more of a strain on your kidneys. So you may need to stop it for 12 to 24 hours and then restart it again when you are feeling better. That's when I also would get in touch with your heart failure GP nurse, just to let them know that you're having to stop it because you're unwell, and they can give you a bit more guidance. So, in terms of practical information with your medications, do take your tablets as prescribed. They are there because we want to help the heart muscle and we want to help it improve and to help you feel better. Do only take medications prescribed for you and not if you run out to take your husband or your wife or your brothers or your sisters. Do ask the pharmacist for help when you're buying supplements or over-the-counter medications, because some of these medications have hidden salt, and we don't like you to take anything that has extra salt in it. Don't take extra medications if you miss a dose. So if you normally would take it in the morning and you're thinking, oh, I don't know whether I've taken that or not, let me just take an extra one just in case, do not. If you think you've missed it, don't worry, just take it the next day. Don't try and make up for it in any way. Also try and avoid taking what we call NSAID painkillers. They're things like Brufen, naproxen or Voltarol. They're often more irritants to the heart and won't help it, so please try and avoid them if you can. Now I know some people give reasons for not taking medications. Oh, I take too many tablets, it surely can't be good for me. I can't go out if I take my water tablets. I couldn't get my prescription, so I ran out of tablets. And the last one we hear a lot of is, I can't afford my tablets. And that's a real problem. But there are answers and help for all of these things. It seems like a lot of tablets, but it is good for you if they're helping your heart. But if you've got a question and you're not sure if actually there seems to be a bit too many tablets here, your pharmacist can be a really good resource to help have a look at all your medications and see if any of them can be stripped back or reduced or stopped. But don't stop taking them on your own. Now, if you are running out of your tablets, I would maybe, if you've got 2 weeks, say, left, or even up to a month, just put a reminder, either on a sticky note or on your phone or via relative, to start ordering your tablets in advance rather than waiting till they run out. We really don't want you to restrict your life. The whole point of improving your symptoms is to help you as much as possible do what you want to do in life and to go out as much as you're able and want to. And so it might be that with your water tablets, if you're feeling they're restricting you, you'd maybe take them at a different time. So say if you know you've got an appointment in the morning first thing and you're worried about needing to go to the toilet, that you could then take your tablets with you, attend your appointment or your coffee date or anything you've got, and then take your water tablets afterwards. And that's no problem. If you're having problems with affording your tablets, then there is help you can access, and you can go online to the NHS website or ask your GP for help. But there's definitely help out there to make sure that you get all the tablets you need to help with your heart condition. Other treatments. So we've done medications. Another treatment that your doctor might recommend you for is intravenous iron. Iron, you think, why are you having iron with heart failure? Well, 1 in 2 people with heart failure have anemia. And people with anemia feel very tired and can get very breathless. So you might actually benefit from having an IV iron infusion. And what we can do is just take a little blood sample, and that has a look at your iron levels in your blood to help us know whether actually you would benefit from that. People often feel less short of breath, they feel less fatigued, and they have an increased exercise capacity, and that's what we want. Now, we run an IV iron clinic here at the Bristol Heart Institute, and there may be other places in your local area who do that too. Another treatment that your doctor might speak to you about is something called a cardiac resynchronization therapy pacemaker. That's a big word. Basically, it's a heart failure pacemaker. It's one that has 3 leads in it compared to a normal pacemaker. Because we know that sometimes people with heart failure have heart muscles that pump out of sync with each other rather than together. And a CRT pacemaker will resynchronize the pumping of the ventricles so that they pace the heart all of the time. And 70% of people report an improvement in their breathlessness when they have a CRT pacemaker put in. Just to note that a CRT pacemaker can also have a defibrillator element added to it, which then shocks the heart if they have a life-threatening heart rhythm. And your doctor may talk to you about whether you want to add on the defibrillator element along with the pacemaker when you have that put in. Lifestyle. So we've done all the things that we do to you. We recommend medications to you. We recommend iron and we recommend devices. Now we're moving on to the bits where you get involved. Lifestyle. Exercise. Now, often people, when they have heart conditions, feel like they shouldn't do anything. I should just sit here and not put my body under too much strain. It surely can't be good for it. It's actually the opposite. We want you to get out and exercise and move your body, even if all you're doing is sitting in a chair and moving your legs, or lying on your bed and pumping your legs. We want you to exercise. It might be that you have to pace the levels of activity that you do. So rather than trying to do everything in that morning that you've got to do on your list, you might have to spread it out throughout the day. So it's more about how you manage your exercise or manage your activity. It might be that you want to start with slow walking and short distances and slowly build it up gradually as you feel able. The key rule we talk about is that you should be able to walk and talk at the same time, which is great when you want to go for a walk with your friend, because it's nice to have company, but it's also nice to have a chat. Listen to your body. It might be that you've done a lot that day and actually you're feeling quite short of breath, you're feeling quite fatigued. If you are, take a break. It might be that you've done a lot the day before, and so it's making sure that you've got factored in for the next day, not much, so you can take a break and have a bit of a relax. The one thing we would ask you to do is to avoid lifting heavy weights. So heavy weights put a bit more of a strain on the heart, and it might be that smaller weights, tin cans, things like that, are actually a bit better for you and your heart condition. A healthy diet. There's a lot of different things out there. There's a lot of different diets out there, and people are just wondering, well, what do I do? The main thing when it comes to your heart is a balanced approach. There are lots of things on the NHS website about what does a healthy diet look like. Most of that is all about a big amount of vegetables, essentially, and a reduced amount of saturated fats. And there's lots of advice out there on the NHS website or the British Heart Foundation website to help you be able to figure out what does that look like for you with what you normally have. But the main thing with heart failure is all about salt. We want to try and reduce your body holding on to fluid as much as possible. And salt means that the body holds on to that fluid. And so reducing the amount of salt that you have in your diet would be really helpful for you and your condition. We do say, however, do avoid anything that has low salt, because low salt has got high potassium in it, which we also don't like. So I would just reduce the amount of salt you put into your food rather than using low salt. The other thing that we talk about is hidden salt. So I mentioned that in some of the tablets that are over the counter, but we also have hidden salt in a lot of processed foods. So a lot of the packaged food, the ready meals have salt hidden in it that you wouldn't know about. And so it's really helpful these days to be able to look at the front, and it tells you how much salt is in each of the ready meals that you're doing. But it's trying to reduce the amount maybe of processed foods and ready meals that you have will automatically reduce the amount of salt you have. Okay, so that's eating. We're now on to sleep and rest. The answer is yes. Please sleep and rest. If you're tired, listen to your body. Don't try and push through. We want you to listen to your body, to rest, to have a nap in the afternoon if you need it. That is okay. We give you permission to do that. It might be that you want to put your feet up because that will help with the swelling in your feet to go down. If you have to increase the pillows that you need on your bed, then do that. Whatever helps you feel better, essentially. We always say aim to sleep at least 45 degrees. And for some people, having a window open at night helps with the air circulating in the room and helps with their breathlessness. For some people, especially when their symptoms are getting quite bad, sleeping in a chair might be more comfortable than sleeping in their bed. And that's okay for short periods. But it's also to let us know if actually that's becoming more common and you're having to sleep in your chair for a bit more, because we might then have to look at some of your tablets to help with some of your symptoms so you can go back to your bed rather than sleeping in your chair all the time. Fluid intake. There's been a lot of thought about, okay, how much fluid is too much fluid, and what can I have and what can I not have? Well, normally the guide is 2 to 2.5 litres over 24 hours. There is no need for fluid restrictions unless you have a low sodium, which your GP will tell you about, or you are very fluid overloaded, so you're very unwell and you've got a lot of fluid in your legs and your abdomen, and so your doctor said, actually, let's put you on a short fluid restriction just for a short amount of time. It might be that you're someone who drinks a lot of water. You like your big bottles of water and you have lots of them a day. It might be that that's when they say, can you just restrict the amount of water you have for a short period of time and then go back to a normal amount of 2 litres. When it comes to alcohol, we ask for you to either abstain from it or just have small amounts. We know that alcohol can be a restrictor to the heart muscle, and so trying to avoid having lots of it, at least reducing it as much as possible, would be a good thing to help your heart. Tips for the fluid, especially if you're having to restrict it for a short period of time, is to maybe think about spacing out your fluid over the day, or using smaller mugs so you don't chug down big mugs, or using ice lollies or freezing fruit, and that way it's got a bit more fluid in it and it helps keep your moist mouth and stops you from feeling dry inside of your mouth as well. We want you to feel comfortable in your mouth, and so trying to drink all your fluid at the beginning of the day and leaving you very dry at the end of the day isn't going to help you out. But just try different things out until you feel comfortable with what works for you. Travel. Short flights are definitely recommended. With long haul, you might be able to do that, but it really depends on your condition and how stable you are. So I would definitely go see your GP or heart failure nurse beforehand to see what they recommend. But it's definitely not ruled out. Check with your GP regarding vaccinations. It might be that you need certain vaccinations for where you're travelling for that will help protect your heart. Travel insurance is a must. You do not want to be stuck abroad, suddenly feeling fluid overload and breathless and having to be admitted to a hospital if you don't have travel insurance. Take enough medications. In fact, I would take spare. I would take extra, because you don't want to lose your medications and suddenly not have enough. You don't want your flights to be delayed and suddenly not have enough. I would take more than enough that you need. And also take a copy of your last clinic letter or discharge letter. That might be useful if you are admitted as well. Keep hydrated. The weather in other countries might be very different to Britain, and you'll be sweating a lot more and losing a lot more fluid than you would do if you were at home. So you may want to drink a bit more than you would at home if you notice you're sweating a lot more or doing a lot more than you would be if you were sitting at home. So, living with heart failure. There's a few more things to talk about. Comorbidities, those are other things that you have in your life that are not your heart failure, but things that will impact your heart failure. We want to get good control of your diabetes, good control of your COPD or asthma, because those are other things that will also affect your symptoms. Vaccinations, we definitely would recommend for you both to have the flu jab and the COVID jab if possible. Anxiety and depression is really very common when you're diagnosed with any condition. So we really want you to feel like you can speak to us, speak to friends, speak to family or your GP, and to get help and support. Rest and exercise can really help with those conditions as well. If you're really struggling, then medication might be required, and that is no problem. There are medications the GPs know to avoid with the heart and those that are fine with the heart. But if you need them, that is okay. Other tips I would say in terms of managing and living with heart failure is for you to start owning that. We want you to monitor your own condition, to do regular weights at the same time every day, wearing the same clothes. So don't go on the weights one day with your boots on, your coat on as you're rushing out the door, if the previous day you were just in your pyjamas. that will definitely affect the weight. So monitoring your weight at the same time with the same clothes every day is a good idea. That gives you an idea as if your weight is gradually increasing. We know that might be because it's been Christmas and you're eating a bit more. If it suddenly jumps up, that's a clue that actually, maybe I put on some extra fluid and I need to get in touch with my GP. Check for fluid buildup. It might be that last thing at night, you have a little look at, okay, how are my ankles doing? How are my legs doing? The places that you know you often collect fluid. How am I doing at night? Am I finding that, I'm needing an extra pillow these days when previously I was only on 2? Take your medications. Yes, I'm saying it again. Attend appointments. We have lots of people waiting to have appointments with us, but if we've sent you an appointment, it's because we need to see you, we want to see you, we want to make sure that you're doing okay and to help with your condition. Definitely keep your heart failure helpline number to hand and phone us if you have any questions at all and there's anything that you want to go through. So, what do I look out for? When do I need to get help? These are all the questions that patients often have, and these are things that we call red flags. Red flags are when to seek help. When is it okay to stay at home, and when do I need to let someone know? Increasing shortness of breath is definitely a red flag. Waking up at night short of breath, a red flag. Unable to lie down at night, so you're finding you're having to sit in your chair at night using extra pillows. It might be that you've noticed, my fluid, it used to be just on my ankles, and now I'm noticing it's on my thighs. Not great. It might be that you get new symptoms of dizziness, chest pain, or palpitations that you never had before. Those are all times and when it's good to get hold of your GP or heart failure nurse, and there might be something that we have to do to make you feel a lot better. We then have some things where you might just want to keep an eye on it, but you don't necessarily have to let us know yet. And there, we'll call them amber flags. Keep watch. It might be when you're unable to walk and talk, when you used to be able to go for a walk and talk to your friend at the same time. It might be that you're noticing you're not able to walk for as long as you used to, or you're feeling more fatigued or generally not as well as you used to. Now, there might be other things going on, nothing to do with your heart failure, but it's something to keep an eye on, and if they get worse, to get in touch with us. There are lots of resources out there. The main thing is for you to know that you are not on your own. There are lots of people you can talk to. You can talk to your GP, your heart failure nurses or consultants, but there are also really good websites and resources out there. Fightingfailure.co.uk is a great resource for patients and carers and health professionals alike. The British Heart Foundation has a plethora of information out there that's really accessible, and they have great stories of other patients who have been through what you've been through on there as well. And there's also a patients charity run by patients themselves called Pumping Marvellous, which I think is a fun name. But that can be a really good support network for yourself or your family who are just struggling about how to manage this condition. So that's everything for now. Remember, you're not on your own. Remember, you have other people you can speak to. And our whole aim is to help your symptoms, to make you feel like you're able to go out there and live your life as much as possible without feeling completely restricted and restrained. Thank you for watching.